I would say now triply challenged with issues that affect us right here at home. We were already working on, for the last several years, more intensively than ever around the erosion of the right to asylum under this administration, the problems at the border, family separation, all kinds of issues where the medical and psychological expertise of Physicians for Human Rights was absolutely essential and profound. And then we had the pandemic, and PHR did a huge pivot into working on a range of human rights issues around that. And then we had the killing of George Floyd and the massive outpouring of anti-racism sentiment and demonstrations and organization across the country, which was received in many places with police violence and excessive force. Another area, longstanding area of PHR's work in other places around the world. And now we have the current election crisis, which isn't exactly directly in PHR's sort of lane, so to speak, or area of work, except that we are preparing and or anticipating possible violence if things continue to spin out and escalate and tensions mount, and there's violence in the streets. And so I've been in PHR for 34 years and I've never had a year like this one. And I think it's something that's really extraordinary for you as medical students to be engaged in a human rights organization while you're in medical school this year and probably in the next few years, because the human rights movement has been challenged globally as never before. And almost every issue we've ever worked on over these decades is present now in some way or other in our work, and challenging everything that we have to bring to the table. What I wanted to do this evening is spend maybe about 10 minutes just clipping through a very, very truncated little sort of framing and history of PHR, not a full history, but just a couple of signal points, and then a couple of slides about what we're doing primarily right now. And then I'm not talking a lot about the organizational structure, how we work, how you get involved. We'll leave that for like a discussion as soon as the little presentation is over. But it's really this is your time as soon as I'm done, what you want to talk about, what you want to ask me about. There are many, many other colleagues at PHR. I hope you'll meet quite a number of them at the conference. But I've been around and I've a long time with the organization, and I work in most of our areas a bit. So I'm happy to answer whatever I can and provide you with more resources to follow up. So with that in mind, let's see, am I on the screen share or no? I have to put on the screen share. Hold on a second. Oops. I'm seeing my slideshow, but you're not. Hold on a second. Yeah. Oops, that's not it. Hold on a second. No. Why isn't this opening? Screen sharing to pause. Okay, one sec. I'm going to try this again. Sorry, guys. I thought I had it all up. I did. Now it's not appearing.
I can corroborate that.
What? It's not appearing?
Oh, that you had it up before I was.
Oh, okay.
But
Is it
I
up now?
No.
Oh, gee. Okay. Sorry, guys. Hold on one second. I don't know why it's not popping up. 1 second. I've only done this a few times. I don't do this a lot. Let's see. Let's try again here. From beginning. Now? Yes.
Yes. Looks good.
Okay. Okay. So this is our slogan. And we have a longer mission statement, but on much of my material now, you'll see this: through evidence, change is possible. And this really speaks to what Physicians for Human Rights at its core is about, which is that we are focused on bringing science, medicine, the expertise of public health in a rigorous way to the documentation and exposure of human rights violations. And I think this notion that the science can bring evidence that will, we hope, present truth. And of course, we know that even that is being challenged every day these days in certain quarters. We believe and we know from our history that change is indeed possible. Some cases it's an uphill battle, but what I want to do is show you, whoops, oh, this is not good, how PHR advances change by evidence and the evidence basis of so much of our work. So overall, we promote health by protecting human rights, and we are based on the international human rights law framework, which includes the Universal Declaration, which isn't actually a law, it's a declaration. We celebrate it every year on December 10th. It's a great time to organize an event on your campus or with your students in your chapter or out in the streets even, because Human Rights Day is the day when the Universal Declaration was adopted in 1948, when the UN, shortly after the UN was formed. And if you look at that declaration, you will see that almost every single one of the 30 articles, the sort of listing of rights, is connected in one way or another to health. That's another session. We'll do that sometime maybe. But what we do is mobilize the skills and influence of health professionals to protect and promote human rights. We conduct investigations using science, medicine, public health. We expose what we find in the media and in the medical literature. I would say that over the last 3 decades, we've actually almost created a new field in medicine as well as in public health, where journal article after journal article over the years has presented an array of understandings such that this has become, in effect, a legitimate and more widely understood and discussed field in the or area in the field of medicine, as well as, frankly, in human rights, where when we started, people didn't understand in the human rights movement all of the ways in which medicine could contribute to the movement, and now it's really integrated in a very unusual way, in a really profound way. And we conduct advocacy, as you know, to create change. And another area of our work is training and specific skills, and I won't get into that in great detail, but I'm going to show you a couple of examples of how we do that. So one of the main messages that you in your chapters and as you form and grow PHR wherever you are and get engaged with it is to try to explain and convince others in your field, in your school, in your hospital and clinic eventually, why should health professionals get involved? And there are so many reasons, but one is, the most obvious one is that human rights violations carry with them and result in profound impacts on physical and mental health. Health professionals, unfortunately, are actually implicated sometimes in violating human rights, and it's really important for the profession to hold one another accountable when doctors, for example, participate in torture, which happened here in the United States. The power of the professions is extraordinary. There's a global movement of health professionals. We have the World Medical Association based in Geneva, which brings together the medical associations of many organizations of many countries. We have many national specialty organizations that link together at the international level, and they have been, in many cases, pioneers in promoting and supporting human rights. And when they do that, it's profound, partly because of the credibility and influence of the medical profession in almost every country. Rallying to support colleagues who are under threat, who are in danger, that's another signature role of an organization like ours, and we've done that kind of work since our very earliest days. Also, there are many health professionals who end up treating survivors of human rights violations, including those seeking asylum, but also people in prisons, people who've been victims of human rights violations in the context of war, refugees, etc. So there's a whole movement that's arisen of people who specialize in treating survivors and whole communities even of human rights violations. There's very important research, as I mentioned, and of course, this fact of irrefutable evidence, especially another area of our specialties has been forensic science, the use of forensic pathology, autopsy information, where the evidence from those forensic scientists is absolutely irrefutable and has been brought to some of the most important international tribunals and courts in the world. So I'm going to now just give you a couple of examples of our work in a number of places, some from history right to some of our current work, and hopefully leave a good chunk of time for our discussion. But I just want to note, and this is sort of, I'm going to flip through the past and go into the present in some of these slides. Right now, Physicians for Human Rights has made a concerted effort to sort of up our game, if you will, by investing much more in terms of the infrastructure of our organization in scientists and doctors and other specialists who really get engaged with us in a very deep level. And so for the first time now, we have 2 medical professionals who work more than 2/3 of their time professionally at PHR. That's Dr. Michelle Heisler and Dr. Vineet Mishori. And they are engaged with both our research and advocacy projects. And I will add that both Vineet and Michelle got engaged with PHR when they were medical students. And now they're 2/3 of their time on our staff, and they're both full professors of medicine at their respective medical schools, Michelle at University of Michigan and Vineet at Georgetown University. But on the right here, you see that we have just in the last year created an advisory council. There are some lawyers here, but they're mostly doctors, many of them very distinguished, international group that we're building and growing, who bring, you can look on our website actually under About PHR and see all of their bios. They're from all over the country and the world, and it's growing. And these are real top experts that we call on for advice, information, reviewing our reports, sometimes even engaging in pieces of research, etc. So just going back quickly, some of the things that PHR is most known for, if you want sort of like somebody asks you, well, who is PHR and what are they about and what do they do? It's sometimes useful just to mention some of our signal projects and efforts and accomplishments over the years. And one of the most notable one is our investigation all the way back in 1992 into Cambodia's use of landmines, which resulted in a report called The Coward's War, when PHR called for a complete ban on the use of this weapon. And at the time, it was the most widely used and cheapest conventional weapon in the world. And fast forward 5 years later, we, with many, many hundreds of organizations, ended up achieving, working also with governments and with the UN leadership, a treaty banning the weapon. It's the most widely endorsed weapons ban in the world. For this work, PHR shared in the Nobel Peace Prize shortly after the treaty was signed in Ottawa. And so what we did for this effort was to document the actual health consequences of landmines, for everything from the deaths, the morbidity and mortality for rates for people who step on a mine when they're forced back into a certain area, for example, which was what we did for Cambodia, to the incredible challenges in the emergency services or in surgery or for blood, the loss of blood, the need for blood, the harm it causes over many, many years in terms of disability. And so the work that we did on landmines extended to almost every aspect of public health, rights, harms caused by weapons and projections of damage to whole communities and medical systems. Many of you are engaged in our asylum work. It's one of our earliest programs. We launched the program almost within a year after we were founded in 1987. I joined the staff in 87. PHR was started in 86 by a group of 6 doctors who felt that they had something to bring to the human rights movement. And very soon we realized that health professionals, right in their own locations where they were working, in their cities and their towns, could do something really extraordinary for human rights by documenting injuries and other trauma caused by persecution, and bring their evidence together with the legal advocacy conducted by a whole network of pro bono lawyers, and succeed phenomenally well in gaining asylum. And as most of you know, we now have this as a major program of the organization. And this is just some data from the numbers and how the organization or the network and program has grown in the last few years. We trained 152 medical professionals in 2017. And just in the last 3 years, the number's almost 3,000. Part of this is the incredible interest and growth and need of this program and this work since President Trump was elected. But it's always been a need, and we decided in the face of the erosion of the right to asylum to expand the network dramatically. And frankly, the model that we have now, where we work through medical school asylum clinics, has also enabled this massive expansion of the network, and we hope it will continue to grow, largely with your help, actually. Speaking of advocacy, and I mentioned this early on, we have been challenged as never before in the last few years. And here, really profoundly, doctors have not only done the asylum evaluations, but gone to the border, spoken out in front of detention centers in cities and towns across the country. Very often medical students wearing their white jackets, speaking out as doctors. It's a very powerful message. And of course, the COVID crisis has made the advocacy around detention centers and the pressure to depopulate those centers for the protection of everyone has mounted. And I would say that doctors, medical students, nurses, public health activists have really driven the movement on these issues. And we hope that with the Biden administration, a lot of our pressure will result in very rapid change in certain areas, at least certain closure of some camps, opening up of the numbers, ending the Remain in Mexico policies and other policies like that. Just quickly moving back now to other parts of our work, I mentioned the forensic science. I'm just going to quickly clip through a couple of images from our historic work. The exhumation of graves is something that PHR has a very, very strong history of conducting, especially for the prosecution of war criminals. And our forensic scientists here, Dr. Haglund, is actually a forensic anthropologist, but worked very closely with many forensic pathologists to document the mass graves in Bosnia in the 90s. And that work resulted in the conviction of the most egregious war criminals from that conflict. We also were very involved in setting standards for documenting and providing evidence of torture. So for example, we have the Istanbul Protocol was initiated by PHR. We're now in the middle of updating it with these 180 experts from around the world. It's actually been updated. That document is now being reviewed by the UN. Will probably be published by the UN either in 2020. It might get delayed because of COVID and a lot of delays in Geneva to next year. But still, this is a huge effort of the organization to create international standards. And of course, unfortunately, we had to work, as I mentioned, on torture in the United States. after 9/11, and we have a series of reports that we did documenting torture, something that we're very, very proud of and widely known for. That work is still actually not completely over. We have, as you see, worked on some of the most egregious international human rights violations, including genocide, where we documented the genocide in Sudan. And very interestingly, I was very involved in this work where, you know, hundreds of thousands of people were forced off their land, their villages destroyed, the men killed, women raped, people displaced, crops, agriculture completely devastated. And now, this was in the mid 2000s, and now, you know, 15, 16 years later, we see the main perpetrator, former president of Sudan, now in prison in Khartoum, and possibly will be handed over to the ICC, the International Criminal Court. So a lot of our work where we document and where we advocate takes many years to see the results. And the same, unfortunately, is true of some of our most recent work, which I know will be the subject of a panel at the conference, on the relentless and systematic attack on health in Syria, the bombings of hundreds of hospitals, the utter destruction of the health system in 2/3 of the country, and killing of many, many doctors, probably at least 1,000 doctors, and other health professionals killed during the course of this war that's now almost in its 10th year. PHR has brought these cases and done most of the most detailed documentation of the attacks on hospitals, such that we've been invited to testify numerous times at the UN Security Council, but we have not managed to achieve justice for these crimes. And I believe that one day that will happen, but sometimes our work involves documenting and advocating and then continuing to advocate until change happens. But how do you get involved in that kind of work when you're medical students? One way is just to be visible, to be out in the streets. This is us, I guess, last fall in front of the UN with partner organizations. But you see here, I think one of these is the professor at Turo. Who's at Turo here? Somebody's here at Turo, right, Mike?
Yeah, it's Dr.
You recognize? Yes. But others, medical students, other doctors, and other activists have come out. This was a truck, the trucks in front of the UN saying stop bombing hospitals. And then we get to this year, and we'll move on to a conversation, but I do want to just quickly, and you'll hear more about our current work at the conference, but note that when we pivoted to the COVID crisis, we started by working on access to PPE, and particularly for frontline health workers, because we were just absolutely horrified, and so were many of our colleagues, about the absolute lack of preparedness for this pandemic and the failure of the pipeline of the most basic protective equipment, compounded by then the silencing and intimidation of health workers who were speaking out about the lack of safety. And this is something that continues. We're actually very concerned that there will be another shortage of PPE in the face of the current surge. And this is why I believe that President-elect Biden's new task force or committee that he's organized to combat COVID will include the mobilization of the Defense Production Act, which PHR has also called on, to really create a nationally coordinated supply. I mean, one of our biggest concerns about the failure to confront the pandemic in any way adequately in the United States has been the failure to exercise any national standards, any national mandates of any sort. So PHR is currently calling for a national mask mandate. It's something that Biden has mentioned. Our request may be a little more than what they're calling for right now, but you may have seen that PHR has created these as masks that we're giving out to anybody who donates more than $50 to the organization. So we're going around saying, because science, guys. And we're sold out, so we're creating more. But it's actually something that we're trying to get people to do. And this is another thing that students can get involved in is creating, I think we're going to share with you all, maybe before the conference, maybe at the conference, sort of an ability to do one of these on a photograph of yourself for social media, and to start to promote this campaign on Facebook, on Twitter, on Instagram, etc. And as I mentioned, we're also working on crowd control, weapons, and excessive force in the context of protests. One thing we've done just in the last 2 weeks is we created a national roster of more than 35 doctors who sort of answered our call and are located now in about 19 cities across the United States where we believe there could be a spike in violence around protests, either by police or by other groups who are incentivized in one way or another to commit acts of violence, where doctors may be able to document injuries, mostly remotely. We're not sending people out into any demonstrations or out into harm's way, but really to be available to comment on tear gas, the harm caused by tear gas, rubber bullets, other excessive force, which is something that PHR has a great deal of expertise in over many, many, many years. We are also working on the disparities that have been so markedly visible and exposed, race disparities, economic disparities, disparities based on location even in the country, and access to health care, but also globally, the dangers of COVID if it should spike in refugee camps, in internally displaced persons camps, in war zones. So we've been very active on that front as well. And then finally, this is sort of the list of our current advocacy, in particular focused on health professionals. We are now looking at PHR's position on a range of human rights issues regarding the vaccine, and that's a very complex area, so we haven't been that outspoken yet, but we just commissioned a study by a human rights, public health, epidemic disease analyst, and we'll be looking at, where can physicians for human rights make a difference on the rollout of vaccines. There are a great many human rights issues that will come to the fore. We already have on our website, if you're interested, a short paper that 3 members of our advisory council and Dr. Heisler wrote around the politicization of and the pressure to roll out a vaccine. At the time that they started drafting it, there was this thought that there would be pressure to roll out a vaccine before the elections for political reasons, and it would not necessarily be safe or effective. So now we've seen this week what's happened with the Pfizer results, but again, we know that's going to take some time before it's ready, and then there will be a big dilemma of who gets it first, how do people who need it most get it, who pays for it, etc. So I'm going to stop here and open it up to any kinds of questions that you all have about PHR. We can end this share about how we work, what you can do on your campuses, anything you want to know, any questions you have about what I showed you, what our current work is, happy to answer. One of the reasons I wanted to give you that background is so that if your leaders in the organization are starting a new chapter, you kind of are grounded a little bit. I strongly urge you to probe around on our website. There's a massive amount of material there. It's probably overwhelming. You can always sort of pick the issue that you're most interested in, but there's a lot of learning to be had there, including this amazing number of webinars that we've hosted every single week, dozens of them since the pandemic started, and those have gone way beyond PHR's normal scope of work, I would add. But we've had really leading experts, and what's been amazing to me is to see how many of the people we've recruited to do these webinars didn't a lot of them already knew a lot about us and loved us and said yes immediately, but others were like, yeah, I'm interested in that. Who are you? And then once they connect, they're just totally hooked. So this is, as our director says right now, this is our time as an organization. This is our time because of all the issues that are before us right now. Never in my 35 years almost working at PHR has the need for an organization like this been so compelling and critical. So I don't know how you want to do this. You want to put your hands up? You want to just open your mic and talk? Whatever works. We're not.
I did have a question
Yes.
regarding PHR's work. So for me, I find it problematic that, you know, the United States exists as the only developed nation where we don't have universal health care. And so, you know, innately it's a human right, I believe, and I'm sure we all believe that. So I was just wondering if PHR is doing any work in that realm, or if we're planning to go in that direction.
Yeah, it's a really good question, and it's come up a lot over the years. And part of the, just to sort of step back a second, we're not a huge organization, and when we started, we came in and looked at where there were gaps in medical organizations working on certain issues. And we ended up picking a number of issues where we felt nobody was really addressing those issues. The right to health is clearly an underpinning of all of sort of human rights work. And when doctors are working on human rights, it's a given that there's a right to health that we support, that we advocate for, etc. That being said, how we work on the right to health and what issues we choose within that is very challenging because we can't work on all of it. And when we get to look at because we're an international organization and we work on the right to health everywhere, we essentially do not have a particular stand on what detailed policies deliver the best right to health, except in the most global way that everybody should have access. It should be equitable, it should be affordable, it should be of good quality, all the things that the right to health and international law say that the right to health should embody. But there are many other organizations way better equipped than we are and more knowledgeable in the down in the weeds battles around what that should be. Medicare for all, single payer, once we get into that, the Affordable Care Act, we realize that, we could become an organization that just does that. We wanted to be effective, and we would need to interact with a whole group of medical organizations that have been working extensively on that. And so it's not an area that we go deep in. We message about it. We encourage people to find organizations that are working on, what they think is the best way forward in that. But we have a very wide tent on, what the right, let's say, what the right policies should be, let's say in the United States or any other country, where there are always going to be disparities and gaps. So we have worked, for example, historically on race disparities in the United States. We did a big report like 15 years ago where we collected this huge bibliography, the first major bibliography on the literature on disparities, and we did a big advocacy on that. We did actually join, the late Senator Ted Kennedy in his messaging around health as a human right, that actually some of that messaging led to Obama's policies. We have a lot of friends in groups like Physicians for National Health Plan. So they have been, they're a group that really works specifically on that. We didn't want to kind of encroach onto their territory. So part of how organizations decide what they prioritize is also where do we bring something that's where there's a gap and a need that other organizations aren't filling. As you probably know, there's also Doctors for America have been, a very big organization working also, and also started when they were called Doctors for Obama by Vivek Murthy, who's now been named as one of the top doctors, the former Surgeon General, to work with the President-elect Biden's campaign. This may not be a satisfying answer to you, and I recognize that. I think PHR will get more engaged more explicitly in the right to health because of the COVID pandemic. And so we've started to go like, well, we really need to be here. So we're discussing it, but if we spread ourselves too thin, we won't be effective in anything. So that's our challenge because we're not a big organization.
No, I think you did more than enough to answer the question. And it is a complicated issue in that there's no, magic wand to say, now we have universal healthcare in the US, because, the policy changes is quite expensive, I think, for that. For me, it's just this past year I was living in France, and it's just a stark contrast to how
Shocking.
effective it is, and it just makes sense, And like you said, with the pandemic, it's just exacerbated everything. So
yeah, and I mean, especially when you're in the medical student movement of PHR, and you're engaging with human rights in your medical schools. I think it's very useful and important to learn about the right to health. Even if PHR itself as an organization, we're not deeply working on it explicitly. Everything we do at some level is about the right to health, really. Any of those issues I mentioned is connected to the right to health in one way or another, but not necessarily how to provide health care for everybody. That's a specific subject under the right to health, let's say. But I think it's great for you to have events where you focus on that, where you learn about it, where you invite speakers, and discuss that in your groups. We're totally for that.
thank you.
Who else?
Hi, I have a question just based on your experience or the experience of anyone with a sort of solidified PHR chapter at their university. I found it really interesting when you mentioned the torture that went on after 9/11 of innocent people, and that's something I was hugely interested in and involved in undergrad. So I think that's more than unfortunate. I can't even think of the right word for that at this moment. However, this might be just an experience on my campus, but I was wondering how you or anyone might handle like negatory reactions to wanting to advocate for things like that. For instance, like if we wanted to do something like that at our chapter, where we advocated for like recognition of like the inhumane things that happened after 9/11 to citizens. I don't know, like I guess I can definitely see a reaction on the opposite end. And I just want to know if anyone has ever experienced anything like that and how you dealt with it.
It's a really good question. A lot of the issues we work on are controversial, no question about it. And I have to interact with the mainstream establishment medical community, like the AMA and leaders in medicine in different locations, and or not in medical school, just in the medical community, but just out in the public at large with the media and so forth. And I think the first thing to say is that when it comes to something like torture, in international law, torture is one of the rights that is legally called non-derogable, which means there is never, ever a justification for torture to be practiced. The United States has signed the Convention Against Torture and ratified it, and also it's in our Constitution. So what I think it is useful as medical students and as future doctors to know a reasonable amount about the international and domestic legal framework so that you can argue or respond like, wait a minute, are you saying you support torture? Torture is absolutely prohibited in international law and domestic law. If you look at PHR's material, you will see those arguments. The easiest and simplest way to kind of grab those often is in our press releases, or in the introduction or summary of our reports, because some of the reports are really hefty and you're not going to have time to read them all. And we have a series of 4 reports on torture in the United States. So the first thing is to sort of, without getting overly defensive, just say, well, we're a human rights organization. I work for human rights. These are rights that are supported by our government. So in the United States, the government went awry, right? And there is a huge, then the next response that I would give as PHR is to talk about the physical and mental harms, and to really try to, like, often storytelling will help to explain, like, this is what happened to this person. Do you think any human being should be, treated like that? Now, there will be people who will say, yeah, they're scum, they deserve to be tortured, they're terrorists, they're this, they're that. And that's why going back to the law is really important, because rights, I love to use this. I learned this from one of my mentors in human rights when I used to work before PHR at Amnesty International. He said, rights are not awards given out for good behavior. You might have done the most heinous thing ever, and you cannot be tortured. And, everyone has a different way that they come to support something that is a human rights violation. But usually it's through the process of othering. And so when somebody can consider somebody else as less than human, then they could be shot, killed, executed, persecuted, arrested, and tortured. And that is, the extreme of that is genocide. And we've seen how that can happen. Not that you want to be necessarily saying, like, this is definitely going to lead to that, but we know from history. And I think the more that you sort of study these issues, are able to tell a story, are able to, peg something on the law, and then also kind of make the human connection and bring empathy and common humanity into the conversation, you have answers. But at the end of the day, you may not convince everyone, and then you need to say, this is my belief, this is what I'm doing. I'm respecting every human being, and not necessarily convince them, but have them understand that what you're doing, it has a strong basis in both science and the law. And I think that's where PHR actually has certain advantages over other political organizations in this arena, because we can go to the science, we can go to public health, we can go to medicine, and we can go to the law.
Thank you. That helps a lot.
I have a question.
Yeah.
So since Anahita and I just started the chapter, I guess I was just wondering if you know the types of things that people will sort of do to start, or not start their chapter, but sort of get other students like more involved, or ways that we can get involved in the community. I know when we spoke to Vina previously, she was saying see what the need is for, like, in your community. And I know that a lot of student chapters participate in asylum clinics, and I think in our particular area, I don't feel like there's a large need for that here. So I guess I was just wondering what sorts of things that we can do at our chapter, if you have any like ideas or things that other student chapters have done.
Yeah, well, this is a great question, and there are many answers. And like you said, some of it is contextual, what works in your community, what works in your university, et cetera. But I'm curious if anyone else on the call has a good answer of something that's worked in your group.
Sure, yeah, I can give an overview a bit, because I actually come from a chapter that does not have an asylum clinic either. So one thing I would just mention in terms of asylum is, even if you do not have an asylum clinic at your medical school, you can still get trained through one of our asylum clinics. So I am trained. I have done an asylum clinic training, and you can connect with, I know MUSC, for instance, has a clinic. So you could connect with clinics in your region. But aside from that, it's also, I mean, you can do community level work, but you can also we work a lot on national advocacy projects. I'll drop in the chat right now. Our advocacy team has an email that you can contact about their ongoing advocacy projects. We include some of those on our website. What we find to be more useful, frankly, is when we put up campaigns on social media. It's much easier to get a rapid response to those types of messages through social media as opposed to putting it up on our website. Because the only way to drive people to our website is through social media. But just for instance, some of the things that we've done is we did some advocacy campaigns around the George Floyd killing. We did some student members, particularly from Georgetown, actually met with PHR staff last year in Washington, D.C., and met with the Department for Homeland Security. And then we obviously have the conference, and usually there's, this year, I actually don't think that there's an advocacy campaign just because everything is virtual, but typically we have one with the conference as well. So you can feel free.
People actually go somewhere, right? Or do a demonstration or stand in front and get, yeah.
Correct, yeah. The Syria campaign, the same thing that Susannah showed as well. But a lot of what we've kind of transitioned to this year is actually moving campaigns online. So like PHR, we've started to do webinar series. We really encourage you all to write blog posts, or something that our advocacy team has worked on this year is currently working on, if you're interested, is creating like snippets of videos from your students and faculty members to talk about human rights projects that you all are invested in, either nationally, internationally, or in your local communities. So you can feel free to contact them or contact us at the phr.sab@gmail.com. And we can give you some more information about some of the projects that we're working on as a board, and what some of our chapters around the country have worked on. And there's actually, maybe a last plug if it's not in the chat, there is actually a tab on our website that goes into some detail about what chapters have done in the past, the types of projects they've done. So please feel free to check.
Yeah, and that's very useful. I mean, the other thing is, I think there are two types of things. One is something to organize and galvanize your group and get people to join, and hear about you and learn. So because of Zoom right now, and because people aren't doing lots of lectures and traveling all over the place, we may have a group of people who could speak to you. You could organize a talk by, Michelle or Renee or other people on our advisory council, et cetera, just for your group or for a group of groups, or, you could organize across a number of PHR chapters. It could be regionally connected or not. But that's something that, we can help with. There's also, you could possibly organize, if you're ever gathering, even in small gatherings, a screening of a film that connects to this work. Even, we have a little video that's kind of like or slideshows that are introductions to PHR, not like the one I prepared for you tonight, which was very particular, but about specific issues or projects or programs we have. So that could be like a way to introduce people. And then there's the activities that really are around advocacy. So for example, I mean, I hope there will be creative ways to support this mask mandate campaign of ours, because it really is something we're going to continue now through this period when a lot of bad things can happen before there's a new administration. And, as you all know, the numbers are really terrifying, and there isn't any consistency across the country. And we see that, honestly, the spike in new cases exactly matches the map where people have resisted, and political leaders have resisted the idea of wearing masks. So we think this is a really important campaign, and you all can do social media stuff with it that could be very creative. Create a little mini video, post it on your social media, try to get stuff going viral, tag it to PHR, you know, and I think there are a lot of activities like that that are advocacy oriented. And also, just as a one final thing, I mean, definitely go through the student website and all of these advocacy opportunities through the students. But if you're not seeing something that grabs you, PHR on our main website has a take action section, and you can also look at that and see if there's something relevant that you think would grab your particular community.
Okay, thank you so much. I appreciate yours, and I forgot what his name is, but his response as well.
Mike.
Yes, Mike.
Other ideas or questions or advice for the new chapters? Yes. Katra.
One question that I had was, if you know, we have the time in our educational schedules and we were looking for, you know, more of a professional experience, are there opportunities to like intern or,
Yes.
you know, do a rotation or some kind of organized, you know, pro bono, you know, work like that?
Absolutely. Absolutely. So you can sort of query that through me or Michelle and Mike to convey to the national staff, but we do have medical students who do rotate, not your kind of rotations, but PHR rotations. And sometimes students have taken like a whole semester if they have a gap, like a sort of a pause, or a few months. They have sometimes they're actually subsidized by their medical school, and then they would work under a particular PHR expert or staff person on a particular research project. We're doing more of that because we have doctors Heisler and Mishori. And so there are opportunities. There aren't massive numbers of opportunities, but definitely it's something we're interested in, and we're doing more than we used to. There are also just straight out kind of internships, and we have a whole internship program. Those are for both undergrad and graduate students. And if you look at the website again about PHR, and you look at, you know, there's something that says volunteers or opportunities or work up, there should be a thing for internships there. So when medical students do internships, it's kind of in a particular category, and it's very special. And we usually have them doing, you know, quite substantive work, and sometimes even, you know, getting your name on a journal article, a peer-reviewed journal article.
Thank you so much. Thank you.
Any other? I know our time is close to the end. If there's one final question or comment or request, also, what you'd like to see us do more of?
I have one question.
Yep, and then we'll wrap.
So my name is Malvika, and
Hi.
so I actually started a PHR club at my high school, Johns Creek High School. It's located in Atlanta, Georgia.
Wow, good for you.
And so we were just wondering, like, if there are any opportunities that you guys have to help, like, students in high school, especially those interested, like, to go into the medical field.
Wow, yeah. I wish we had more to offer, because we tend to not even really do undergrad college for PHR chapters. Most of our chapters are at medical schools, but we have had some active high school groups occasionally. I'm not sure, I don't know, Michelle and Mike, if you have thoughts. You're welcome to join the conference, obviously. But we don't, because that's not our prime constituency at this point, we don't have a lot of stuff that's special for high schools. I know that, you know, I love you you know, it'd be very interesting if we could maybe do a webinar for you and your high school classmates or other pre-med, you know, pre-med students. To talk about, you know, like maybe hear from some of you all of how you got involved in human rights, and how if you started in high school with your passion in human rights, how you navigated through undergrad and then medical school. we might be able to get Dr. Mishori or Dr. Heisler to participate in something like that. So why don't I say, Malvika, that you, if you want to email me, first of all, I'll put my email in the chat here, and I'll try to, you know, see what we can do, but also we can discuss this with the SAB as well, the Student Advisory Board.
Okay, thank you so much.
And
Malvika?
really keep it up. It's you know, if you start in high school, you'll be there forever. Not high school with PHR.
Yes,
Right?
Malvika, you said you were in Atlanta, is that correct?
Yes.
Yeah, so I actually went to Emory undergrad. So it's kind of within the realm of PHR, at least with like working with asylum seekers and whatnot in the medical field. But I don't know if you've heard of the Harriet Tubman Women's Clinic there. It is a lot of Emory undergrads who are pre-med, and as well as the Emory School of Medicine. They have med students and pre-meds work there, and a lot of times the patient population is asylum seekers because it deals with women's health who are uninsured. Just in case you're maybe not able to do specifically PHR stuff, but you're interested, you can maybe reach out to them, reach out to Emory and see what you could find, especially if you're interested in the medical field. I think that's a really great opportunity. I'm not sure how much you can do, but I think it's worth reaching out to.
Oh, thank you. Yeah, that's a good idea.
No problem.
Also, we have on occasion had high school students as interns, especially in the summer. So that's another option, just to get engaged. I'm not quite sure. It's a little harder working remotely, I think. A lot of our high school interns have been kind of like office support in a way, but it's worth a shot. So check out the website for that as well.
So where exactly are the internships? Like, oh, you're on mute.
Oops, sorry, it's wherever you are. We haven't opened up our offices, and we're all from home at the PHR staff. So usually the internships are in our offices. We have our headquarters in New York City. We have an office small set up in Washington. We have an office in Boston, which is where I am. And before the pandemic, used to commute to New York. And then we have an office in Nairobi. But the internships are usually most of them are New York and Boston. But now they could be anywhere, which is great. I mean, we couldn't have done this. We could have, but we weren't doing this before. So it's opened up a whole new way of working. That is very positive.
Okay, thank you.
So I'm sure you all have many things to do ahead. Feel free, if you wanted to ask a question, didn't get to ask it, send me an email. Make sure the headline is really good because I get a ridiculous amount of emails. So put out, follow-up question student or something in your headline so that I'll answer it. And I really hope you'll all come to the conference. It'll be really interesting. There'll be a lot of different issues that we'll be talking about. And I know that Sebastian and his colleagues have done a wonderful job and a lot of time planning. And Michelle or Amy, do you have any closing anything? Thank you for hosting, Amy.
Thanks so much.
And
everyone.
thank you all
so
for
much.
coming.
Sorry.
Stay strong, stay safe, stay healthy,
Thank you, Susanna.
Thanks.
stay optimistic.